Then accessory motion. So accessory motion is just what you would be doing to test the joint play if you were to actually do an adjustment. So if you ever get stuck, just think like, how would I test this if I was going to adjust it? So for this portion of the test, you can do all of the right side of the body and then all of the left side of the body. You don't have to compare side to side. It's recommended that you learn a flow for this so that you can just continually go through, because sometimes if you look at the sheet of paper, it's confusing to figure out where exactly you are, because it's easier to go in a different order. So for superior inferior glide of the humerus, you're just going to pull the arm down to see if there's any hyper or hypomobility. Then you can jump to P to A and A to P glide. So you're going to test the shoulder A to P, bring it in, test it P to A, and then lateral, so bring the arm out with your hand in the patient's axilla, and test here, and then you can have the patient bring their arm over. So then we're going to test the posterior lateral glide of the humerus. You can stabilize with your sternum, bring both arms around like you were to do an adjustment, and then slight medial to lateral to get the lateral component and push back there. Any pain with any of that? Nope. And so we just showed you superior to inferior glide of the humerus, P to A interior glide of the humerus, A to P glide, lateral distraction, and then posterior lateral glide of the humerus. So then get all of your humerus ones done first, and then you can go on to the SC joint. So then standing in front of your patient, you can then kind of push in A to P. You can move the SC joint at the clavicle superior and inferiorly. There's no real way to actually go P to A. Like, you can kind of have them hunch their shoulders, and you can do a slight pull if you really wanted to, but just be careful because you can dig in, and if you pull off the clavicle, it actually really hurts. And then rotation, have them rotate, so up and down, so you can actually have your finger there and you can figure out what the glide is, and then have them move their shoulders front and back. And so that is the glide, posterior, superior, anterior, and inferior glide of the SC joint, as well as clavicular rotation. And then you can get to the AC joint and figure out if that needs to have an adjustment. And then for scapular rotation and scapular glide, you can just take your hand, come into the scapula, and then move it around to see if there's any restriction in motion. So you don't have to spend a lot of time on this. They're just looking to see if you're going through all of the stages. So that's accessory motion of the shoulder.